So dear students, now there is question number 6, which is actually structured questions again. So in this I have combined around 13 questions from past year papers, and I have also given their answers, so you can go through the answers and you can see the revise it for your exams. The first question is classify antiepileptic drugs, describe mechanism of action, uses, adverse effects of valproic acid, and why valproic and clonazepam should not be used together. So you can see the classification and the mechanism of action, uses, adverse effect, and why they should not be used together, because they can result in additive sedative effect. Next question is classify antidiabetic drugs, describe current treatment guidelines for type 2 diabetes mellitus, mechanism and adverse effect of insulin sensitizers, and management of diabetic ketoacidosis. So here is the classification, the current treatment guidelines, the mechanism of and adverse effect of insulin sensitizers, and management of DK. The third question is again a clinical based question and with four answers. This is a case of opioid overdose and mechanism of action of opioids, management of the case, and antagonist. Fourth question is again a structured clinical question. This is a case of diabetes, and in this they have asked for classification of antidiabetic drugs, then mechanism of action, precautions and insulin therapy, and 2 symptoms of hypoglycemia and management of hypoglycemia. The next question is on anticholinesterase and describe the diagnosis and treatment of OPC poisoning. So here diagnosis, treatment, and is given in detail. Classify extended spectrum penicillins, describe mechanism of action of beta-lactam antibiotics, and spectrum uses and adverse effect of amoxicillin. So the names of extended spectrum penicillins, the mechanism of action, spectrum uses, and adverse effects are mentioned here. Question number 7 is classify the drugs used for chronic heart failure. What would be the aim of treatment, and explain the rationale of using ACE inhibitors. So classification of drugs used in CHF is given, then aim of treatment in CHF, rationale for using ACE inhibitors, and adverse effects of ACE inhibitors. Eighth question says about bronchial asthma, why antihistaminics are not used, enumerate bronchodilators, their mechanism of action and adverse effects, and describe pharmacotherapy of acute severe asthma. So asthma, bronchodilators, then the classification of drugs, pharmacotherapy of severe asthma is given. Enumerate beta receptor blocking agents, describe the pharmacological action, uses, and adverse reaction. So classification of beta blockers is done, their pharmacological actions, their therapeutic uses, and their adverse effects. Then again extended spectrum penicillins is there. Then a structured clinical question. It is on benign prostate hypertrophy. So the answers, mechanism of action, drugs contraindicated in BPH, and role of finasteride. Then the 12th question is on peptic ulcer. So peptic ulcer के बारे में है, uses of omeprazole, adverse effects, and anti-ulcer drugs used. 13th question is explain why treatment of TB. It's on TB. So why it is done with multiple drugs, and enumerate 4 uses and 4 adverse effects of rifampicin, and the treatment regime for the newly diagnosed case of pulmonary TB. So here again you have to I've written the answers, so all the answers are here, the treatment regime. So this is the question number 6, the structured question. Let's see the question number 7 and 8 also. So students, now we know that short notes, question number 7 is again short notes, and this I have compiled again the topics from past year papers, and there is a beautiful compilation of 134 short notes. I've just given you the gist part of it. You have to definitely expand on this, and once you have expanded and written a little bit more, then you can aram se complete this. get good marks in the short notes. So there are 134 total short notes, and this will give you a good revision. And question number 8 is again explain briefly. So here again it's a compilation of questions from past year papers, and there are around 100 and how many are there? Let me see. There's a compilation of 106 questions in total. Brief explanation about them. So you can go through this and download the PDF and then study it for your revision.